Welcome to this session. Today, we will be discussing the topic of advocacy. Advocacy is a deliberate and organized effort to influence decision makers and bring about positive change in society. It is not random action, but a systematic process that follows clear steps to achieve meaningful results. In this session, we will illustrate the concept of advocacy using a practical example, the malaria control program in Newtown community. Through this case study, we will see how advocacy can be planned, structured, and implemented to address real health challenges and improve the lives of people. Health problem. This means carefully defining the issue you want to address. A problem must be clear, specific, and supported with evidence, data, records, or observations. Without a clear problem, advocacy efforts may be scattered. Newtown example. In Newtown, malaria is identified as the main health challenge. Records show that 40% of clinic visits are malaria-related. Children frequently miss school, and pregnant women are at risk of complications. The root causes include blocked drains, stagnant water, and low use of treated mosquito nets.
And we can cut down malaria cases by half.
Identify the desired outcome. The desired outcome is the end result that advocacy efforts aim to achieve. It answers the critical question, what change do we want to see after our efforts? It is not just about identifying or addressing the problem, but about painting a clear picture of what success should look like. A strong outcome must be specific, measurable, achievable, relevant, and time-bound. This smart approach ensures that the goal is clear and realistic. Without a clearly defined outcome, advocacy becomes directionless, like shooting arrows without a target. Having a clear outcome matters because it keeps every member of the advocacy team focused on a shared vision. It also makes it easier to convince policymakers who are more responsive to concrete goals. Outcomes provide a standard for measuring success, ensuring that progress can be tracked and evaluated. They also help to prevent wasted resources, since every activity is guided by a clearly defined end result. In Newtown, the identified health problem was the high prevalence of malaria, caused by poor sanitation, stagnant water, and the low use of treated mosquito nets. So the advocacy group therefore defined their desired outcome as reduce malaria cases in Newtown by 50% within 3 years through improved prevention, treatment, and sanitation activities. This outcome is specific because it focuses directly on malaria cases. It is measurable with a clear target of reducing cases by 50%. It is achievable since with government support and community participation, such a reduction is realistic. It is relevant because it directly addresses the malaria burden in the community, and it is time-bound with a 3-year deadline. For instance, imagine if Newtown only said, "We want to fight malaria." That would be vague, giving no real picture of success. But when they say, "We want to reduce malaria deaths among children under 5 years by 50% within 3 years," it becomes clear, measurable, and focused. Such a statement also motivates policymakers because it gives them a goal they can commit to and be held accountable for. Tiku, wetin dey happen o? Step 3. Select strategies. Now that we know what we want to achieve, The next thing we must think about is how to get there. This is where strategies come in. A strategy is simply the broad approach we decide to use to reach our goal. It is like the roadmap that guides us on the journey. If the desired outcome is our destination, then strategies are the roads that lead us there. They help us answer the question, how exactly do we achieve this change we are talking about? When we are selecting strategies, it is important to remember that no single method is enough on its own. Real change happens when we combine different approaches, working with policymakers, mobilizing our community, raising awareness, and building partnerships. This way, everyone has a role to play, and the burden does not fall on one person or one group alone. In Newtown, where malaria has become a serious problem, we realized we could not sit back and hope things would improve by chance. We needed practical strategies. First, we thought of lobbying our local government. If we could present our case clearly, we could push for funds to construct proper drainage systems and to distribute treated mosquito nets to households. Next, we looked inward at what we as a community could do. That is how the idea of community mobilization came up. We agreed to organize monthly cleanup exercises so that stagnant water, the breeding ground for mosquitoes, would be cleared. But we also knew that keeping the community healthy was not only about physical action. It was also about spreading the right information. So we planned to use media engagement. By working with our local radio station and even social media platforms, we could constantly remind people of simple prevention steps like sleeping under mosquito nets and keeping their surroundings clean. Finally, we understood that we did not have all the resources we needed. So we looked outward. By forming partnerships with NGOs, health agencies, and even international donors, we could get both technical expertise and financial support to strengthen our malaria control efforts. These strategies together gave us a sense of direction. They helped us see that if we worked smartly and combined governance support, community action, awareness, and partnerships, we stood a real chance of cutting down malaria in Newtown. It was no longer just a dream. It was a plan we could follow step by step.
4. List tasks related to each strategy. Once we have chosen our strategies, the next thing we must do is break them down into specific tasks. Strategies on their own are broad, but tasks are what bring them to life. They are the smaller, practical activities that make the work organized, clear, and achievable. In simple terms, strategies show us what we want to do, while tasks show us how we will actually do it. As a health worker in Newtown, I often tell people that advocacy without clear tasks is like planning a journey without deciding which vehicle to take or which road to follow. Tasks make the plan real. They give everyone in the team something concrete to hold on to, and they make it easier to monitor progress. For example, when we chose lobbying the government as one of our strategies, we didn't just stop there. We asked ourselves, what exactly must we do to make this lobbying successful? The tasks became clear. We needed to prepare policy briefs with evidence of how malaria is affecting our community. We had to collect testimonies from families who had lost loved ones so leaders could feel the human impact. And we had to schedule meetings with local councillors and health officials to present our case. When we talked about community mobilization, we knew that meant more than just telling people to gather. The tasks included training youth leaders who could inspire their peers, distributing mosquito nets to vulnerable households, and scheduling regular sanitation days where everyone would join hands to clean the drains and clear stagnant water. And for media engagement, the strategy sounded good on paper, but it needed practical steps to work. So we decided on tasks like producing catchy radio jingles in the local language, organizing talk shows where experts and community members could speak about malaria prevention, and even sharing short health tips on WhatsApp groups to reach the younger generation. By listing these tasks, our strategies no longer looked like abstract ideas. They became living actions we could carry out step by step. It also helped us assign responsibilities so that everyone knew their role. Some would handle the media, others the sanitation drives, and others the government meetings. This made our malaria control program in Newtown not just a dream, but a real movement that involved the entire community.
Yes, this is a serious concern. We will take care of it.
Identify tasks that require policymaker action. At this stage, we need to pause and ask this very important question. Which of our tasks can the community handle, and which ones absolutely require the involvement of policymakers? The truth is, not every task needs government approval. Some things, like sweeping our compounds or clearing the drains around our homes, are entirely within the community control. But there are bigger actions, those that need funding, official backing, or even legal enforcement that only policymakers can handle. Identifying these tasks helps focus our advocacy energy where it is most needed, so that we don't waste time pushing leaders on matters that could have been solved by the community. In Newtown, when we carefully reviewed the malaria control strategies, we realized there were key areas that required direct action from the leaders. For instance, they could organize community cleanups, but the community could not fund large-scale distribution of treated mosquito nets or purchase anti-malaria drugs for the health center. Such needed a budget allocation from the local government. We also saw the importance of having a sanitation bylaw. Without such a law, many households might ignore their responsibility to keep their surroundings clean, and the mosquito problem would continue. Passing a bylaw would mean that everyone had a duty to maintain hygiene, and those who failed to do so could be held accountable. Another critical task was the routine spraying of mosquito breeding sites. While community volunteers could do small cleanups, large-scale spraying requires technical expertise, equipment, and chemicals that only the government or health agencies can provide. Without policymakers approving and supporting this, the community's efforts would not be enough. By separating what the community could do from what required the hand of government, our advocacy became sharper and more effective. Instead of overwhelming leaders with every small request, we presented them with specific, high-impact tasks that only they had the authority and resources to accomplish. This way, our message was clearer, our expectations were realistic, and our chances of getting results were stronger. Set objectives for policymakers. After identifying the tasks that require government involvement, the next thing we must do is to set clear objectives for policymakers. Objectives are like targets we give to our leaders. They are not just wishes or vague demands, but specific, measurable, and time-bound actions that we expect them to take on behalf of the community. When objectives are well framed, they make it easier for leaders to understand exactly what is required of them, and they also allow us to measure whether or not progress is being made. As a health worker in Newtown, I often explain it this way. Policymakers are busy people with many issues competing for their attention. If we simply tell them, help us fight malaria, it will sound too broad and may get lost among other priorities. But if we give them specific objectives, it becomes clear, practical, and something they can be held accountable for. For example, one objective we agreed on in Newtown was, by the next budget cycle, allocate 30 million naira to malaria prevention activities. This gives our leaders a concrete financial commitment with a clear timeline. It is no longer just talk, it is a measurable goal we can follow up on. Another objective we set was, ensure every primary health facility in Newtown stocks malaria rapid diagnostic kits and ACT drugs. This objective is important because without these basic tools, malaria cannot be detected or treated effectively. By making it an official demand, we shifted from being a community complaint to a government responsibility. We also proposed a bylaw that would directly involve households in the fight against malaria. Pass a bylaw enforcing community sanitation exercises twice a month. This objective gives legal weight to what we already encourage as a community. With such a law in place, everyone is obliged to keep their surroundings clean, and those who neglect this responsibility can be sanctioned. These objectives are not random. They are carefully crafted to meet the SMART principle: specific, measurable, achievable, relevant, and time-bound. Each one addresses a key aspect of the malaria problem in Newtown, such as funding, access to treatment, and environmental control. Together, they form a practical set of expectations that leaders can act on and that we as community health practitioners can monitor.
Select the content information policymakers need. When it comes to advocacy, passion alone will not move policymakers to act. Leaders are often faced with many competing demands, and the ones they respond to most are those backed up by solid evidence. That is why this step is so important. We must carefully select the right content and information that will convince policymakers to see malaria control as a priority. As a community health worker in Newtown, I quickly realized that while our people understood the suffering malaria was causing, our leaders needed more than emotions. They needed facts, figures, and stories that painted a complete picture of the problem and the benefits of solving it. Without such information, our voices would remain just noise in the background. So, we gathered evidence. We started with health data from the local clinic, which clearly showed that malaria was the #1 reason people visited the hospital. The records revealed that children under 5 and pregnant women made up the majority of cases. Presenting these figures showed the human cost in a way that no guesswork could. Next, we prepared simple maps of Newtown, highlighting areas where stagnant water had collected, blocked drains, flooded compounds, and abandoned containers. These maps made it easy for policymakers to see the connection between our environment and the high malaria burden. Instead of abstract statistics, they could visualize the breeding grounds scattered across the community. We also collected testimonies from parents who had lost children to malaria. One mother stood before us in tears, holding a faded photograph of her daughter. Her story was not just numbers on a page. It was the voice of pain that leaders could not ignore. These testimonies brought the data to life and reminded everyone that malaria is not just a medical issue, but a deeply human one. Finally, we added a cost-benefit analysis. We showed that investing in prevention, like providing mosquito nets, supporting sanitation, and spraying breeding sites, was far cheaper than treating malaria cases at advanced stages. We demonstrated how the government would actually save money by acting now instead of waiting for more hospital admissions later. This economic argument gave leaders a practical reason to prioritize malaria control. When all this content came together, our advocacy gained strength. We were no longer just pleading for attention, but we were presenting a well-researched case that was logical, emotional, and evidence-based. With health data, maps, testimonies, and financial analysis, we gave policymakers every reason to see malaria not only as a community problem, but as a government responsibility that demanded urgent action.
Choose communication methods. One important thing I have learned as a community health worker is that advocacy is not only about what you say, but also about how you say it. The most powerful message can lose its effect if it is not delivered in a way that suits the audience. That is why this step, choosing the right communication methods, is so critical. Different policymakers respond to different forms of communication, and our role is to meet them where they are most attentive. In Newtown, when we began to push for stronger malaria control, we first prepared policy briefs. These were short, well-structured documents that contained evidence, statistics, and clear recommendations. Leaders often do not have time to read long reports, so the briefs summarized everything in just a few pages. Each brief explained the scale of the malaria problem in Newtown, the cost of inaction, and the urgent steps needed. This was effective for council members who prefer written documents backed by evidence. At the same time, we organized town hall meetings. These gatherings brought together community members, health workers, and local leaders under one roof.
During these sessions, parents who had lost loved ones to malaria spoke openly. Youth leaders demonstrated how they had mobilized for sanitation exercises. This method was powerful because it gave policymakers a chance to hear directly from the people they serve. It turned malaria control from a paper issue into a living community cry. We also took advantage of the radio. Radio jingles and programs were developed in the local language to spread prevention messages widely across Newtown. Many of our leaders listened to the community radio station, so they could not escape hearing both the people's voice and the health workers' call for action. It also showed them that malaria control was not only a health agenda but a popular demand, since the same messages were reaching every household. Finally, we used formal letters to give weight to our requests. After meetings and town halls, we followed up with official letters addressed to council leaders, the local health department, and even state-level representatives. These letters carried signatures from community associations, faith leaders, and youth groups. By putting our demands in writing, we created a paper trail that held policymakers accountable and made it difficult for them to dismiss our requests. Select a spokesperson or communicator. In every advocacy effort, the messenger is just as important as the message. A spokesperson is the voice of the campaign, the one who carries the community's concerns and presents them in a way that decision makers cannot ignore. For the message to be effective, the person speaking must be credible, trusted, and able to communicate with authority. Sometimes, more than one spokesperson is chosen to bring balance because no single voice can fully capture all sides of the issue. In Newtown, as we planned our malaria control advocacy, we agreed that our campaign needed spokespersons who represented both technical knowledge and community authority. That is why we selected two key figures. The first was a respected community health officer from Newtown Health Center. She had worked in the facility for many years, treating children, mothers, and entire families who came in with malaria. Her credibility came not only from her professional training, but also from the trust the community already placed in her. She could speak with evidence, explaining the number of malaria cases treated each week, the stockouts of malaria drugs, and the pressure the disease placed on the health system. Policymakers tend to listen to voices that come with data and clinical experience, and she embodied that. Her presence gave the advocacy a strong medical foundation. The second was the traditional ruler of Newtown. In our community, cultural authority carries as much weight as medical authority. The people look to him as the custodian of Newtown's welfare, and government officials respect him as the voice of the people. When he speaks, his words are not seen as individual opinion, but as the collective concern of his people. His involvement also signaled unity, showing that malaria control was not just a health sector issue, but a priority for the entire community. By combining these two spokespersons, the community health officer with professional and clinical authority, and the traditional ruler with cultural and community authority, we ensured that our advocacy message was balanced. One spoke with evidence, the other with legitimacy. Together, they gave our campaign both the strength of knowledge and the power of tradition. As a health worker, I could see how this choice made a difference. Policymakers responded better because they were hearing from trusted voices they could not dismiss. This step reminded us that advocacy is not only about presenting facts, but also about choosing the right people to present them. People who command respect, inspire confidence, and speak on behalf of the people.
10. Inform policymakers of the plan and date. One lesson I have learned as a community health worker is that advocacy cannot succeed in silence. Policymakers, no matter how willing or supportive they may be, cannot act on what they do not know. That is why it is so important to inform them clearly, formally, and in good time about the advocacy plan and the date of the meeting or event. This step is not just a courtesy, it is a key strategy. It ensures leaders feel respected, gives them time to prepare, and increases the chances that they will show up and take action. In Newtown, as our malaria advocacy group finalized the plans, we knew we had to reach out to the local government chairman, the councillors, and other stakeholders in positions of authority. We prepared official letters of invitation, stamped and signed by both the Community Health Center and the Traditional Council. In those letters, we clearly stated the purpose of the meeting: to present evidence of the malaria burden in Newtown, to share community testimonies, and to request government action on prevention and control measures. We also highlighted the date and venue, October 25th, at the Newtown Civic Hall, so there will be no confusion. But beyond the letters, we also followed up with personal visits to their offices. Advocacy is about relationships, and sometimes a letter alone can be lost in a pile of paperwork. When we visited, we explained face-to-face why their presence at the meeting mattered, both to the health of the people and to their leadership responsibility. We also reminded them that malaria was affecting school attendance, workforce productivity, and even community development, issues they cared about politically. To make sure nothing was left to chance, we also used phone calls and SMS reminders a week before the event. These reminders were polite but firm. Newtown Community Malaria Advocacy Meeting, October 25th, 10 a.m., Civic Hall. Your presence will make a difference. This way, no one could say they forgot or were not properly informed. When the day finally arrived, most of the invited policymakers were present. They sat in the front row, listening as the community health officer, the traditional ruler, and affected families spoke. Their presence alone gave the event weight, but more importantly, it opened the door for them to respond and commit to action. As a health worker, I understood that this step was not just about sending invitations, it was about creating ownership. By informing policymakers in advance and treating them as key partners, we turned malaria control into a shared responsibility between the community and its leaders.